Okay, good morning, everyone. Thank you for coming to our press conference about the TTC budget. I will give it a few seconds just for any latecomers to log in. Okay, so again, just want to reiterate, thanks for coming to our conference this morning. We are focusing today on the TTC budget and how it impacts essential workers. My name is Vincent. I've been with TTCriders for quite some time. For those who might not know, a TTC-based organization of transit riders here in Toronto, and we campaign for an accessible, affordable public transit system that connects all of our neighborhoods. So today, the plan of attack is to hear each participant in turn for about 2 minutes or so each. And then we'll invite questions our friends in the media. We are recording this and we are going to be posting online afterwards as a reference. So that's how things are going to go today. First, we're going to hear from Malinda, then Surkhab, finally Abigail, and then myself. And then there'll be a time for questions. So Malinda, why don't you start things off for us?
Good morning, everyone. My name is Malinda Francis. I am a home care PSW. So for people who don't know that, support worker, so I go from home to home and give people personal support. So either that's daily showers or anything that people need at home to sort of independently live with either a disability or an illness. So I primarily use the TTC. So that's my mode of transportation, going from home to home. So I'm on the TTC pretty regularly. So just to start, I just wanted to sort of communicate that PSWs are really tired. We've been in this pandemic for 8 months. I am exhausted, and I'm sure a lot of my colleagues are just as exhausted, and we don't know how long this is going to last. It's probably going to last till the spring. We're just tired. So, if we go back to the beginning in March when we were first locked down, there was a lot of hot blood and a lot of support for us. And, there was claps at 5 o'clock. We were able to actually get, pandemic pay, which happened, and it lasted for 4 months in the thing. And that kind of mysteriously left when we started to open up. And now we fast forward to the September, and the schools opened, the restaurants opened, and that's usually when the kind of support kind of, people forgot about us, basically. And so after the schools went up and then the numbers kind of expectedly kind of increased, we saw like frontline workers were starting to burn out. I know within home care, there's been massive like shortages. Where basically like there was the pandemic pay came back, and that was essentially to keep us working through the pandemic. But we're still burning out, and a lot of us are going to have to work through the, work extra hours during the holidays. So it was really nice to hear that there is going to be a fare freeze. We desperately needed that. My fear was that if there was a possible increase, that our pandemic pay would just go to basically TTC fares. I mean, in my case, because I use transit. But what the thing is, I see that we need on the front line, especially in TTC, is an increase in bus services, especially in the outer layer outer areas such as the Jane bus and the Finch areas, and a lot of areas where primarily buses are the transportation. And it's totally possible because last night, coming home from work, there was an early closure on the line from Woodbine to Broadview, which has been happening a lot of during the weekends, where there's closures on certain lines so that they, are doing maintenance and all that kind of stuff. And so for the first time, went outside to get on the shuttle, and they were actually counting people into the buses, and that I haven't seen before. So it is possible. So if we need to have 100 more buses on each lines, and then that should be our goal, just so that people who are transporting from the outer lines into the city, they are protected, because I think that's what we're going to need to actually bring down the numbers overall. Another issue that I see going from house to house is primarily the underhoused and people who are experiencing homelessness, and especially with the increase in the evictions are going up. We really need more supports for people to be housed so that they're able to distance through the pandemic. And also mass distribution of PPE and masks and hand sanitizers, and ways of people being able to sort of be able to, wash their hands on the TTC. And yeah, I think I'm just pushing for more social distance measures across the city, and especially in the high density areas. I think that's what needs to be done, and there needs to be increased funding for that to happen. So that's all, and I just wanted to say that we're just frontline workers are tired, and we have a long way to go before we get through this. So yeah, thanks for listening, and if people have any questions about me traveling, I'm here to answer those questions.
Thanks, Malinda. Honestly, those are some really good points. I think that people don't hear enough, so it's really good you're able to share with everyone. Surkhab, you're up next.
Good morning, everyone. My name is Surkhab Peerzada, and I work at South Riverdale Community Health Center. I want to just start and acknowledge that this conversation is happening on Indigenous land that has been in use for millenniums. And with that acknowledgement, I also want to thank Malinda for sharing your story. I can't imagine what it's like to work in the homes of people and see what you're seeing. So thank you for what you're doing and raising what you've raised. From my perspective, when I am thinking about the use of TTC, anecdotes and publicly available data that we know, individuals who are relying on transit are also those that are disproportionately carrying the burden of COVID-19 and live in the hotspots across the GTA, but community rates are in double digits. Personally, I've been taking transit to get to work, and out of sheer frustrations beginning late October, I started tweeting, capturing the number of noses due to ill-fitted masks that I was seeing, as well as full faces where people were just not wearing any masks that I was seeing on transit. And when I started doing that, I also acknowledged the privileges that were in my life that were part of that storytelling. So in this pandemic, I have been working for South Riverdale Community Health Center, where a decision was made at a leadership and management level to provide to every staff that works and takes transit a level 1 ASTM certified mask. So I get to take one home, and the next day when I come into work, I'm wearing one when I'm taking transit. And a level 1 ASTM certified mask means that the bacterial and particle infiltration rate is 95% effective. So when I'm taking transit and I see the variability in masking and lack of physical distancing, I'm not afraid for me, but I'm definitely concerned about everybody else with whom I'm sharing that physical and airspace. I do also have other privileges when I think about my transit experience. I have a great deal of control over my schedule, and I live within steps of the one of the 4 subway lines that we have, and one of the 3 subway lines that we have, which is line 2. I have the luxury to skip trains that are crowded, in which when I see physical distancing is impossible, I can decide, okay, you know what, I'm going to just wait for the next one. And I've exercised these choices since the pandemic has begun multiple times. But when I think of other essential workers and all the other people that are on those trains and on those bus routes and on those transit and streetcars, they don't have those choices. That's why they're in those crowded spaces. When you think about also people that live with chronic health conditions that need to get to appointments and have to be at a certain place by a certain time, they also don't have that choice or that privilege that I have just told you. So for example, every morning at Broadway Station, I see the 100 Flemington Park bus come. It's fully packed. And when you see the number of people coming off of that bus, you would not think that we are in the middle of a pandemic. There are often frail people and elderly people that have also ventured out onto those buses and are leaving the bus last. And why do you think that they're out there? They're out there to get to medical appointments. So when I think of this pandemic and what's needed, adding more buses, providing masks to transit riders, public health education that actually explains why masking is important are some of the pragmatic things that we need now. We've not been doing these things. Those little posters where people can rip them off and say, say physical distancing, do not sit here. And the messaging that even TTC has been providing for the last little while, which says, sorry, we can't guarantee physical distancing because we are returning to work. These are not effective solutions. So the questions that I have for all of us as citizens, and particularly for the decision makers, are why should these people who have been keeping our city running in one of the worst pandemic in my living memory, and most of our living memory, be subjected to have to travel in packed spaces that we all know from the science increases the possibility of the spread of the virus? Why should we also subject our vulnerable and frail people of the community to take transit when physical distancing is not possible and we cannot guarantee that people are going to be masked in equally? So from an equity lens, given where and who has been impacted, we need decision makers to work harder to map out and execute a communication strategy that makes it clear to people why masking and why physical distancing on transit is important. We also need to look at and make more accessible a mass distribution program. And lastly, we need to increase services to support physical distancing. As Malinda said, if it means that 100 buses are needed on certain routes, make that happen, because those buses that are coming into transit points are packed. And people don't have a choice, the way I do, to not wait for the next bus or the next train. With the city hitting 50,000 cases in the city, I do think that this is a policy failure and a shameful exercise that is going to make things worse for our marginalized communities. It's still not too late. We think that this pandemic is going to be around at least until we have 75% herd immunity with the vaccine that's come. Something needs to be done, and what's been happening is not acceptable, and I am really concerned. Thank you for listening, and thank you for this opportunity.
Thanks, Surkhab. Thanks very much for sharing your story and the facts. Abby, you're up next.
Good morning. Thanks so much. Thank you to both of you for sharing your stories. It is incredibly important that we're hearing these stories because so often we don't. And so it's really easy for our decision makers to ignore what's actually happening to our community. So my name is Abigail Doris. I'm a registered early childhood educator, and I'm also the executive coordinator for the Toronto Community for Better Childcare. Early childhood educators and childcare workers work very intimately with young children and families across the city, and both educators and families rely daily on the TTC. And the childcare community has been able to keep transition rates low in our centers by adhering to public health guidelines and ensuring that our youngest citizens are safe in their learning environment. This is becoming exceedingly difficult, and it's not because educators aren't doing incredible work to protect children. It's because we rely on transit. The overcrowding and patrons who aren't adhering to the mask requirements have an impact on our ability to support families. Early childhood educators and families can't keep each other safe if our transit system is putting us at risk, and which for many is the only means of getting to and from childcare and work. We need more transit service, especially in our most vulnerable communities where people are already disproportionately impacted by COVID. Early childhood educators, it's a feminized sector. It's a racialized sector. We are impacted not only in our work, but in our communities. Everyone in Toronto depends on someone who depends on childcare, be it directly or indirectly, and access to childcare makes it possible for our entire city to get to work. So healthcare and essential service workers depend on childcare, and the childcare community depends on transit. Without increased transit services, specifically more buses, we can't collectively keep our city safe. Thank you for having me.
Thanks, Abby. And thank you all actually for sharing your stories. Just before we get a chance to go to questions, I just want to point out a few, I guess, macro level things that are going on with transit right now. The TTC is still facing a little bit of a budget shortfall for 2021. We have the first phase of Safe Restart Agreement funding transferred, which is great. We also have great news that the second phase is on its way. So these are two very good things. We have great news that a fare increase isn't happening for the duration of 2021. So three very good things are taking place. But as you've heard, we really need funding from the federal and provincial governments to be increased and made permanent. So making essential workers pay for the pandemic, and obviously for decades of underfunding transit, as long as I've been alive, is morally wrong. It's insulting. So we're happy fare increases haven't taken place, but further increases must be completely out of the question as we recover from this pandemic. We also need funding to make sure the TTC can run enough service to provide for distancing, and we need funding to provide for public education and PPE distribution for the remainder of this pandemic, and indeed going forward so that people can be confident and safe and happy when using transit. Long-term, what we need, in addition to more service, is a fare reduction. And that's something that, again, has never happened in my lifetime, and maybe not anyone's lifetime on this call. So, you know, as you've seen, many depend on transit for a host of reasons, and they need to be safe when traversing the city. And doing so really shouldn't break the bank. So you've all heard what we have to say. So I'm going to open the floor now for questions for our participants. I'm also happy to jump in for some TTCriders macro level answers, and we can get started.
Yeah, Ben, you have your hand up, so go ahead. I think you should be able to speak.
Yeah, can you hear me okay?
Yeah.
Loud and clear.
I guess my question's maybe best put to Vincent. You know, at the start of this pandemic, I think there were some concerns that the TTC was going to respond to this dramatic drop in ridership by slashing service, by raising fares. We're seeing other transit agencies in the US, for instance, you know, look at those options. I know that you point out that longer term there are some things that you want, like fare reductions, but in the kind of emergency footing that we're on right now, is it fair to say that you're pleased with what the TTC has done here, that they're not going to raise fares, that they're not going to slash service? They say there's actually going to be more bus service on the roads next year than there was this year. This is good news, is it not?
So you're right in a sense that it's important to recognize Toronto hasn't had the cuts that other North American cities have had. You look at down south of the border, it's been pretty dramatic. Cities like Atlanta cut their service more than 50%, and it's nuts. So yeah, you're right that we did maintain most of our transit service. The problem is, and why we're not jumping for joy that there is no fare increase and that there's a little bit of a service increase going forward, is that for decades, you know, low-income people have been paying for the transit system through above inflation fare increases. The TTC has been dealing with overcrowding for longer than, you know, before the 2010s into the 2000s. And this has been a long-standing issue that the pandemic has only thrown into stark relief, as the people we need to keep society running are now dealing with this on transit. So again, it's important to acknowledge where good things have happened, but we need to be thinking beyond this to how do we actually build a transit system that people are safe to ride. Well, it needs more funding, it needs fare reduction, it needs services that people can distance. So I'd say, yeah, cautious optimism, but a little bit of frustration. This hasn't been happening for decades beforehand.
If I could just follow up with that, the province and the federal government have contributed substantial operating funding for this upcoming budget, and I guess to balance 2020 as well. Do you think that provides kind of a foothold? Is it possible that could become permanent, or I guess you would like that to become permanent? Could that become easier now, or what?
I guess I would say it's an open door, because I'm just going to point out, and Ben, you're probably aware of this, maybe my other colleagues here are also aware, but in the 1990s, the province sent funding toward daily operations of transit systems, and they cut that. So although something like Fresh Prince was on TV in the 90s, and Fresh Prince is long gone, but we're still dealing with the fact that the province has not funded transit systems daily operations. So the Safe Restart funding is a start in the right direction. The fact that the federal government and the province are partnering to pay for operations is it's a big deal. You're absolutely right. But we need to push harder, and it's an open door, and I think with enough pressure, we can make it happen. There's an opportunity, and I think there's a political window for governments to be spending this kind of money.
Thank you very much.
I see everybody's nodding, so I think.
Oh, thanks so much, Vincent, and thanks
for
the 3 participants for sharing your stories as well.
Now the question is there anybody else who I see a hand up? That was Ben. Are there any other questions, or should we draw our event to a close? Let me give it a few seconds. Okay. So I just want to thank everyone again for joining us this morning. Like I said, we are going to be posting this recording online. So if anyone listening right now or listening in the future on the internet, if you're interested in doing more, the TTC board is meeting on the 21st to vote on the budget. So we as an organization really do need help to organize transit riders in the lead up to this, and potentially to speak at that meeting as well, because we'd really like to see this fare freeze implemented. So please do reach out to us. We do have the press release going out as well, so we could really use the help in that regard. So yeah, that's pretty much it for me. If anyone else wants to say goodbye, and then we'll draw this meeting to a close.
Okay, thank you.
Okay, thanks guys.
All right, good luck.